This conference will now be recorded.
Here's your task.
Actually,
There
ma'am,
are
I'm not
more.
able. I'm not
You're
able
not
to
able
see
to
it.
see it?
No.
Okay.
Uh,
Let me
yeah,
check.
1 minute. Yeah, ma'am. Now it's okay.
It's visible? Okay.
Yes, ma'am.
Right.
Ma'am, do we have the next page for this?
Yes. Just a minute.
Okay.
Okay. We can start.
Yeah, ma'am. Okay.
Hmm.
Hello, I'm Dr. Taskin, one of the doctors here today. Can I just confirm your name and age, please?
Yeah, hi, I'm Julie Roberts. I'm 30.
All right. Is it okay if I call you Julie?
That's fine, yeah.
Yeah, Julie, can you tell me? I first want to apologize you as my consultant is away. It's an emergency. So is it okay if I continue the consultation with you?
Yes, that would be fine.
All right, thank you. Yeah, Julie, can you tell me in your own words what brings you here today?
Well, doctor, I don't know how to bring this up. Actually, the thing is that I've been trying to conceive in myself and my husband. I've been actively trying for the past year or so, and the GP also did some tests. But I'm not able to understand, how you can help me with this.
All right, Mrs. Jolie, I'm sorry for the situation you are going through, but we are here to help and support you. Definitely, I
Okay.
will address your all concerns, and together we'll formulate a safe and best plan for you. Before that, is it okay if I ask you a few questions to know you better?
Yeah, that would be fine.
Yeah, Julie. As you have been telling that you have been trying to conceive for almost 1 year now, am I right?
Yes, that's right.
All right. And can you tell me what have been like any treatment you have received for the same?
Oh, no, no, no treatment as such. Just some tests which have been recently done by the GP is all.
All right. Okay. And is your partner fit and healthy otherwise?
Yes, he is.
All right. And can you tell me, like, have you ever been pregnant before any time?
No, I have never conceived. No.
All right. And can I ask you a few intrusive questions as it's important for the management?
Yeah, that's fine.
All right. Okay. And can you tell me how is like everything going with your partner? Do you have any problem with the sexual life?
Well, yeah, actually, doctor, that is the main reason also that I have come for a consult.
Okay.
I have been experiencing very little sexual drive, and my partner is always complaining about this. I also do not experience arousal, and I'm quite worried and stressed because of this. Even my relationship has broken down in the past, and this is causing me to also worry that again this same thing may happen this time. So, if you could help me with this also.
Definitely, Julia. I'll be connecting you to, some counselors, which can definitely help you in this situation. And can you
Mhm.
tell me how many times do you have the sexual intercourse in a week?
It's hardly now with all this stress and everything. It has almost been once or twice in a month, I would say. And that too, I'm not really in a mood for it.
Okay. Do you feel any pain during the intercourse?
There's no pain.
All right. And where before 1 year you have been on contraceptives?
No, I have no stopped the contraceptive 1 year ago. We used to use condoms before, now we don't.
All right. All right. And do you have any medical illness of concern?
No, not no medical illness.
Any drugs you're on?
I am on sertraline. That's because since the past month I have been feeling very depressed, and I saw a physician,
Okay.
and I've
Okay.
been started on
Since
that.
how long you have been on this drug?
A month, a month.
Okay, a month. All right. And any allergies?
No,
Any history of surgeries in the tummy or down below?
no.
Are you aware of your weight to height ratio?
It's 35.
Okay, 35. And okay, and blood group?
It's B positive.
Right. And may I ask you, do you smoke?
No, I don't smoke.
Drink alcohol?
It has increased now, actually. I used to be occasional drinker.
Okay. Any recreational drugs?
No,
Okay. And may I ask you, Julia, what do you do for living?
I am a homemaker.
All right. And how is your support at home?
Uh, right now, quite well supported, but as I've told you,
Okay, okay, all right. I can understand. And do you have any family history of concern?
nothing comes to mind.
All right. As you told me, you're on a certain leave since 1 month. Now, how have been you feeling during the past, few weeks? Do you feel
I'm
low or
feeling
depressed?
much more upbeat, but I have noticed that I feel less, interested in sex even more.
All right, Julia.
Yeah,
Okay, Julia, can I just examine you in the presence of chaperone to look your vitals, to have a
yeah,
feel of
that's
your
fine.
tummy? All
That's fine.
right, thank you. Thank you, Julia, for giving me this information. Now, coming to your concern, and
Hmm.
also, your GP has got some tests forwarded to me. Are you aware of your test reports?
No.
All right. Okay, I have just confirmed your name and NHS number, and these reports belong to you. And
Hmm.
this is one of the tests is an ovulation study. That means it
Yeah, right.
assesses the functioning of the
Okay.
ovaries, whether the egg is released from the egg basket or not. And what can I see that yes, it shows that on day 15 there has been the egg release. Okay, that
Mm-hmm.
means your egg release is fine. There's nothing problem with that. Okay,
Okay.
and okay, do you have your partner with around you so that we can discuss the reports along with him
No,
also?
that's fine. I believe his sperm was studied and he mentioned it was
Yeah,
normal, yes.
yeah. I also just confirmed this name and NHS number,
Okay,
and that is
that's
showing
okay.
quite normal. Okay, so
Yeah.
we can get like your ovulation is fine, and ovulating fine, and husband's menses is also normal. But about
Mm-hmm.
the function of the tubes, there I can show you that like we have this ovaries, and then we have this fallopian tubes. These are the site which carry egg, towards the sperm and the fertilization, the fusion augurs. Okay, so about that function, we are not sure yet. Maybe we may need to order some tests for that to know the function. Okay, am I
Okay,
clear so
okay.
far? Yeah,
Yeah,
and
absolutely.
yeah. And let me tell you, there are some lifestyle changes, small changes in our day-to-day activities, which can make quite a big effect on our outcome. As I can see that you told me that you occasionally drink some alcohol, but Julia, that is not safe for in case as fertility is concerned. Am I clear so far?
Oh, okay, fine.
Yes. So I will advise you to think or to cut on or to cut down the alcohol drinking. Okay.
Right. Okay.
Also, your weight to height ratio is on a slight on a higher side. That is,
Mm-hmm.
your weight is not in accordance with your height. So we'll
Mm-hmm.
connect you to dietitian and well as the
Mm-hmm.
exercise doctor so that we may cut
Mm-hmm.
it down.
Mm-hmm.
Is it okay for you?
Yeah, why do I have this lack of interest in sex though, doctor? Can you help me with that?
Yeah, Julia, like you are taking the medicine that is a sertraline. So I'll just connect with your, with your specialist who has recommended this, and maybe some patients they experience this effect with this drug. And I'll
Right.
just confirm it with my consultant also, and also with your specialist, so that we can think over to a safer drug which can help you, in mitigating or decreasing these effects. Am I clear so
Oh,
far?
oh, oh, okay. All right. Maybe we can stop that. Um,
Yeah.
is there anything else that you recommend?
Yeah, I recommend your counseling, with our counselors and some support groups, which can also help you in this situation as you're feeling a decreased drive and the arousal. And I'll be also ordering some tests for the functioning of the tubes, whether they are normal, that is the HSG. It's
Doctor,
an
will
X.
laser rejuvenation help me?
Yeah, please repeat, Julia.
Will this laser rejuvenation help me? I read about it.
Um, okay, I'm not so much sure about it. I'll just talk to my consultant and we'll come back to you regarding that issue. Is it
Okay,
okay?
time is up. Time is up, but let's finish this up. Okay.
Okay.
So doctor, do you think you can help me get pregnant?
Definitely, we'll connect you with the infertility specialist also and fix your appointment with the consultant. We'll be just working on some issues like the increased weight to height ratio, alcohol, and the problem which is with the drive, the sexual drive. And
Right.
after assessing the other tests, we'll just make a proper plan for you.
All right.
Okay. Do you have any other concerns, Julia?
No questions as of now. Is there anything else that you would like to ask me?
Mhm. Okay. Okay, I'll connect you to the counselor, support groups, and also fix your appointment with the consultant and the fertility specialist. Thank you.
All right. All right. Okay. Hmm. Yes. Sorry, can you repeat your name, please?
Yeah, ma'am, it's the skin.
The scheme. Yeah, the scheme.
Yeah.
Hi. So, what do you think? Let's have your reflection on the task.
Uh, Actually, ma'am, I got like information gathering was fine, but about applied knowledge, I was not much sure.
Hmm.
On some factors, I could get like BMI is high, alcohol she's drinking, she's on depression, so counseling is needed. But whether
Hmm.
sertraline causes these effects, I'm not so much sure.
Hmm.
And about laser rejuvenation, I had not heard.
Okay. All right. That's fine. It's better to say I do not know rather than, saying yes or no committed
Yeah,
answers.
ma'am.
All right. Let's take a quick, opinion poll from the rest. What do the others think the agenda of the station was, and what will be marked? If anyone can think of pointers, you can at this point unmute and, yes, Dr. Kushi. Okay, we have a lot of SCs and in this now. Dr. Anam.
Yes, Doctor. I attend late, sorry. Even I'm listening at the
Oh,
end.
okay. All right. All right. Is there anyone? No one? It's a smaller group, so you can, pretty much. These are let me start off by telling you the agenda of these discussions that we will be having. They are very small 1 hour sessions which will be discussing the May 24 questions, and depending on the response, how you all want the task to be, or if you all want anything in specific also will be discussed. Now, these are going to be in very small groups. That's why I've not put the link in the main Telegram group, because there's a lot of people attending and then interruptions then. So those who are genuinely interested will be shared on WhatsApp only. And so y'all can, feel a bit more free to speak your mind during these meetings. Okay. So I would really like active participation here from Soumya. What do you think about the objective, Dr. Soumya? Hello? Hello?
Dr. Uma, can I talk? It's-
Yeah, who is this? Your
This is
name is
Suparna.
not sure. Suparna, yes, please.
Yeah,
Please go
I
ahead.
just joined just now, the last minutes only because there was
No
a net
issues.
problem. But
Okay.
seeing the scenario in front of me, I feel because I have no idea how many years this patient has infertility for and not conceived for how many years, that would be one.
Mm,
Whether it is
mm.
uh, means whether she has any symptoms of early ovarian aging or something like that, which I was thinking because looking at only one screen here, right? There is any
So
other
you
screen
didn't
for this?
hear the task, I'm
No,
presuming.
I didn't get the
The
task.
task
Yes.
becomes clear to you in the history, actually. She has come with,
Okay.
let me break it down for
Mm-hmm.
you. So what she says is, I initially, the
Mm-hmm.
first part of the task, we were waiting for how you open the task. Okay, Dr.
Mm-hmm.
Taskin. The good thing that you did here was that you did apologize that the consultant hasn't been there, and all of those things which are there were done.
Mm-hmm.
But remember that wherever fertility is concerned or something, very vague sort of a task is mentioned here. She is desirous of conception. That's all that is given to you. In all subfertility and in all sexual and reproductive health module tasks, please, it's a very good habit to start off by signposting and assuring confidentiality. And again, don't do it in parts. Okay, one of the main things is while you practice it well. You don't, build bad habits right at the beginning of when you're starting your preparation. So, the thing is that don't say that yes, this is going to remain confidential, and then use another sentence altogether for signposting. So here you signposted and you said I may have some personal questions for you. Then again, one more point which was there about confidentiality in communication, you could have said it there and then itself and finished it off. One thing is it will save you time. Secondly, you will never forget things that way. These are the kind of things that affect your marking in the long run. All right, so there is a tick box for assuring confidentiality. For example, in my either it will be under the patient safety, or sometimes they may put it under communication with the patient. Now, when they do so, if you are in the habit of saying these things all in one go, then you would be much wiser. You will be able to say them much more rapidly, saving time as well as not forgetting to say these things. Okay, so Because you didn't say that, I kind of was in the back foot. I didn't want to share a lot of personal things with you because I wasn't signposted yet. So
Mm-hmm.
I started off by saying that, I have been trying to conceive, and this for 1 year we have not been. So we went to the GP, and I got my test done. Hardly anything in the test is, but at least you know that the ovulation is occurring. So that's one factor out, and the male factor is also out because that's mentioned to you as normal. Okay. The moment you signposted, I kind of opened up to you because I also liked the way that you use your tone is quite sympathetic, empathetic, and your voice is very soft. So, role players are definitely going to like talking to you. When that happens, they tend to help you more. Okay. If remember one thing that this is not often discussed by many people, but if you're doing badly in a task, you're going to receive less help from the role players. Okay, they are not likely to, fall in love with you and try to make you pass the station. But if you are doing reasonably well, you will see a definite responsiveness from the role player side as well. They might be nodding, encouraging you in the right direction, and they will also be asking you more and more questions to guide you towards your applied clinical and patient safety marks. Is
Mm-hmm.
that clear, Dr. Taskin?
Yeah. Yeah, ma'am. Yeah, it's clear. Ma'am, you
So,
mean like infertility cases also we had to in the starting say that whatever we discuss today, it will be
True.
confidential?
Yes, yes.
Yeah.
I advise that in all subfertility and
Okay.
in sexual and reproductive necessarily,
Mm.
because
Okay.
in these two modules, you are going to have sexual history. There cannot be a
Mm.
subfertility station that you are completing without asking sexual health, right?
Yeah.
You
Yeah.
cannot complete
I'm
a task.
also in like, may I ask you, like in domestic violence, like whenever we get there are bruises
Mm,
and she has a
mhm.
recurrent pain, in that can
Yeah.
also we say in the introduction only that whatever we discuss, isn't it?
Um, yeah, that is if your task mentions that in the write-up, but domestic violence can come in multiple
Hidden.
different ways. For example, it,
Mm.
it can come without those bruises and everything.
Okay.
She might come to you with reduced fetal movement multiple
Okay.
times,
Mm.
some unrelated
Mm.
complaint and all. In those cases, you may not know at the outset that it is domestic violence. So, when you rule out everything else, that time you can signpost. Okay,
Mm.
and
Okay.
you can proceed with that history. Okay,
Yeah.
so
Thank
now,
you.
yeah, so moving forward, you mentioned that you felt your information gathering was good. Is there anything else that you would
Yes.
have liked to ask
I missed,
to
yeah, ma'am, I missed the menstrual history, important one. And
okay, menstrual
yeah,
history, anything else?
um, and about
Okay,
STIs.
so what do you understand? Yes. Okay, so sexual has to be in when there is a sexual issue here, right? She is
Yeah.
female sexual dysfunction. Okay, so everything related to her sexual life has to be broken down in more detail, and then you classify your history always in your mind about any task that you do. Take up any task, and your history has to be in the form of main presenting complaint. What are the
Mhm.
causes which can be, implicated in this particular presenting complaint? And then you break it down into what are the effects of this as well. So it's not only that, she's having mental health issues, she's been depressed since the past 1 month and she's on medications for the same, but at the same time, what is the cause of that depression? Probably the fact that all of this has been on her mind. She's been trying to conceive. She has a sexual dysfunction to begin with, and then she's unable to cope with that psychologically, which is causing the depression. And that has been there for the past 1 month. So it can be a mixture of all these things. So be very practical in your task, in your approach. Okay. Have you gone through the talk on FSD?
So, HSG, ma'am?
No, FSD, female sexual
Okay, female
dysfunction.
sexual dysfunction. Yeah, yeah, during my part two, but I don't remember so much.
Don't remember so much. That's fine. But okay, now let's look at this history in a very practical, pragmatic manner. All right. So now, as I mentioned, your sexual history had to be in a lot more detail, including the onset frequency. Since when has the, frequency of intercourse been reduced? Since when is she hypoactive from a drive perspective? Okay, is she able to experience orgasms or not? Okay, is there any pain that you asked me? So you were trying to get to the bottom of why is there sexual dysfunction. Sexual dysfunction can be in three different categories now. One is arousal related and desire related. Okay. One is pain related. Okay. And the third one is orgasm related. All right. So you need to ask all of these things. So I would have told you that yes, whenever I do orgasm is not a issue, but she has reduced drive, reduced intrinsic drive, let's say. So why is this there? All right. Is there any dryness at the time of intercourse? Okay. Or are they used to scheduling it? All right. If you read the talk in between, you'll be able to see that in people with subfertility, there it tends to be more sexual dysfunction as a consequence of having been trying or stressed out about the pregnancy itself, which means that they might be trying to schedule the intercourse around the time of ovulation. It's causing more stress to the individual and reducing the drive. Okay, so all of these things which may be responsible for it. Okay, additionally, what are the other causes which may cause a woman to have reduced drive? Now, can you tell me? Don't look at the slide without looking at the slide. Will.
There can be like pain, which can lead to, or something problem with the body image.
Yes, could be those
Yeah.
things. Okay, anything else? There could be actually physical issues, no, which is resulting in some sort of discomfort. Okay. Now, the
Mm-hmm.
leading causes around this thing will be like having any sexually transmitted infection. So you need to ask for the symptoms of those as well, like any discharge, postcoital bleed, etc.
Mm-hmm.
Okay, pain otherwise as well. All right, and yes. So let's go back to our. This is your role player instruction. All right. So bowel, bladder disturbances for any physical gynecological complaints which may also be contributing to the reduced sexual drive. Okay. So in those will be any heaviness, any mass or any structure coming out per vagina. Okay. And then menstrual history you have to ask in detail. Obstetric, you confirm that I was nulliparous. So that's fine. And any medical comorbidities. Here I would say unnecessary information like blood group. Was it going to help you in any manner
No, no,
to
it was not
change your
necessary.
management? No, no. So you can straight away skip it. Okay, skip it. So reservation for transfusion, all that history can be skipped. However, in any station, never skip BMIs, okay,
No.
allergies, all right, and support. You asked that. That was very good. All right. So you got to know that her BMI was on the higher side. Also, she has been drinking. So now all the stations which are coming in the last two exams, November as well as May, we have noticed that college adds a lot of multiple factors in the station. So you need to have a holistic approach while treating any patient or any role player. Okay. So that is something that you always need to keep in mind. So whenever you are dealing with such things, many of the students will come and ask us how to tell so many things are there no, wrong with the role players, how to tackle these stations. What you do is simply, firstly, keep calm. Okay, because if there are risk factors for you, your role player, they are there for almost everybody. All 14 people are performing the same circuit, they are doing the same task, so they are faced with the same challenges as you as well. So calm down and make a notation of what are these issues which need to be handled. It's not as difficult as it might seem to you. Okay? For instance, the fact is that BMI was high and she was drinking as well as she was depressed and she was on sertraline or whatever that antidepressant that she is on. Okay. Apart from this, have you noticed anything else positive in this history? No. You should be able to narrow the station down at the end of your history into these four things with your main complaint. Got it, Dr. Taskin?
Yeah, ma'am. Yeah.
Yeah. Okay.
You're.
So,
Mm.
we are going to deal with how to tell her about the management just in a bit. But before that, as I was saying, causes, okay, and effects. Effects, like for example, how her relationship is. This, if she doesn't volunteer the information to you, then you have to ask her, right? Do you think this is affecting your quality of life? Do you think
Mhm.
this is affecting your relationship in any manner? All right? Is
Yeah.
she worried about this? Hmm? There can
Mhm.
be other etiologies for having negative associations with sex, like there can be sexual abuse in the past. Okay,
Mm.
which is why I have put it in red. Is this history is extremely important. Okay, and this would be a star point for you in your information gathering. So if this is not asked, because it is very, very relevant to this main complaint that she's come with. Okay.
Okay.
Hypoactive sexual drive. So, is there any negative body image that you mentioned to me after, when we were discussing just now? So, that is one thing. Plus, any sexual abuse in the past or any traumatic or negative associations associated with sex. For example, if she has unrealistic expectations or any negative feelings. Okay, this is the way you can ask. Do you think you have any negative feelings towards sex in general? Okay, this can be in the form of anxiety or fear of pain. All right, all of these things, and majority of these times they could be associated with sexual abuse or other mental health issues as well in the patient. Okay, now whenever you do also get a patient who has depression, please complete the depression questionnaire, as in how have you been down depressed low? That is already covered. Okay. But do you how are you feeling now? That was one good thing that you asked me. Then I told you I'm feeling quite upbeat. So probably this is the reason why you didn't proceed with the question about self-harm. But it is customary that any depressed patient at all points of times or visitations be screened for a tendency of suicidal ideation or self-harm. Okay, all right.
Yeah.
Yeah. So
Yeah.
that is one thing. And do not forget that it is a culmination of SRH and subfertility module. So there is also fertility aspect. So you ask about partner. Can you tell me more about your partner? Has either of you parented a child? Rather than asking one thing, you can ask in her obstetric history, but has he fathered a child before? Because NHS funding will become a relevant thing. And obviously, have you received rubella vaccination in the past? Okay, so this will be your information gathering. Now, how would you score yourself on this after looking at it? Okay, so the reason why I'm asking you is often you can self-assess. Okay,
Yeah.
after looking at the answer probably or what was expected out of you, you can self-assess in a better way. Put yourself under the microscope every time that you're practicing a task with your study partner and see what you may have missed, which is causing the losing of marks. Okay, part 3 is an exam. It is in such a format that you need to go out there and score your marks for yourself. It's not that they were in your hand and they are going away. You need to actively do things in order to scrape those marks, okay, from the examiner. So this is the reason I'm telling you, is because often we get asked the question, why did I not pass information gathering? Why did I not pass patient safety? Okay, a lot of people after the exams when they join us, then these are the things which are asked. So you can also self-assess and see why or how you lost marks. Okay, got it? Now, let's go to this is just I have done a write-up of how you would ask about the screening questions which are there. They are also there in the TOG which I was talking about. So do you have any concerns about your sex life, and are you currently sexually active? If yes, no, then is that related to your health problem or not? Okay. Also, problems with sexual desire, libido, arousal, orgasm need to be asked specifically. Okay, got it? So this is what we discussed earlier. Just done it in the form of a write-up. All right. How many of you think that offering examination was necessary in this station, and how many think it was not? Like it would not have been marked. Dr. Chaitra. Dr. Chaitra. Hello. Okay. All right. Anyone? Okay. Dr. Taskin, it seems like it's just you and me.
Ma'am, yes, ma'am, it is important.
Yes. Who was that? Anam says also yes, it's important.
Ma'am, it is
Yes, it
important,
is
ma'am.
important. It is important. It is going to be marked in this particular scenario. The reason being, some of the etiologies you can rule out by examining the patient. So, whenever you think that examination might change what you are going to advise the patient, okay, in your management, all right, because the task tells you to do three things. One is take a relevant history, which is basically saying you have marks for this domain, information gathering, addressing her concerns, and making a safe, acceptable, mutually acceptable management plan would be your applied clinical knowledge and patient safety, and how you talk to the patient throughout marks your communication. So now, when this is there and it is going to help you to make a management plan, please mention examination there. In all other tasks, it's not required. Okay, in all other tasks, it is not relevant. Everybody has this standard way of doing the I would like to examine you in the presence of a chaperone now. I would like to take your temperature, pulse, BP, blah blah, God knows what else, and which has no bearing on the management at all, and it doesn't change the management at all. In those situations, you're just simply wasting a minute there talking about all these things. Okay, but not here. You would be marked for mentioning examination. Wherever it is relevant, examination always has to be very specific. You have to tell what you want to look for. Okay, so not pulse BP. Pulse BP has no bearing here at all. You need to tell her that I'll examine you from down below with your permission in the presence of a chaperone, and to look for if there is any evidence of any infections, pain points, etc., and to assess your pelvic floor. Okay, because often those things also are etiologies for your sexual dysfunction. Okay, so you need to assess that. Then we are going to go to patient safety. Now, what do you think about the management plan? Let us, before we go on there, let's ask the rest also. Come on, volunteers for this. Yes.
Can I,
Dr.
ma'am?
Sindhu?
Um,
Yeah, sure. Who is this? Arifa. Yes, please go ahead.
and psychosexual counseling can be given, and adequate foreplay can be given, and
Right?
they can try fingering technique and vaginal dilators. If she has any dryness, means we can apply any oil or lubricants,
Let us take one thing. Okay. You go on. Let me see. Okay. Dilators. Then what else you said? Hmm.
lubricants,
Finger
psychosexual
technique. Okay.
counseling,
Counseling.
adequate
Okay.
foreplay,
Foreplay. Hmm. What else?
um, mm,
You mentioned lubricants also, I believe. No?
yes, ma'am, lubricants.
Okay. Okay. Now I'm telling you in history there is no dryness. Okay.
Okay, okay, ma'am.
And there in the past, okay, this issue that she's been having has come after the age of 20 when she had a chlamydia episode, okay, which is there in my history
Okay,
because I was not asked about sexually shared infections. I did not share that. So let me tell you what the role player had. Okay, so she has
okay, ma'am.
had here, if you can see, when the pressed and where is it? Mm, all right. I have one episode of chlamydia at the age of 18 or 20, whatever, which was fully treated in a gum clinic. Okay. So does that change anything for you? Do you think?
Mm,
Need to examine her, and if there is any discharge or secretions, take swabs again and send her to
Yes, that
gum
is true,
clinic.
but there is no discharge and secretions now. She's been fully treated. The reason that this was there in the exam is that sometimes post certain experiences like sexually shared infections, as I said, in abuse, etc., past history becomes extremely important. When did this issue start for her? Was it a primary thing that she always had, or is it secondary to certain things like her current partner, or was it secondary to something else, some other event which happened in her life? So, for example, if she has it after the chlamydia infection, it might be that anxiety has set in or anxiety disorder has set in regarding the sexual intercourse post the infection episode. Okay, so it could be relevant in the form of that. However, now coming to your management, how would your management change because of that? Your management is basically going to be all of these points. Okay, education about sexual life, like explain to her since she is having negative thoughts about sexual activity, that is it is a completely normal physiological process. Okay, additionally, the first primary thing here would be multidisciplinary team and psychosexual counselor. But alongside that, you have other advice to give her as well, which Dr. Taskin was doing. Like, for example, lifestyle measures, such as she needs to, have a routine yoga, exercise, relaxation techniques can be followed by her, which will basically put her in a positive frame of mind in her mental health condition. It will help her. Okay, hypnotherapy is another thing that can be tried. If you go through the talk, these are all the things which have been mentioned there, right? Also, you need to advise her about cessation of alcohol, which may be actually adding to her, okay, counterproductive with all of the issues that she is having, and it is a vicious cycle, okay, that she's fallen into, that she's having these issues and she's countering that with alcohol and food. She's eating a lot since the time this has happened. This was again another history which was not picked up on, but her BMI has increased, okay, because she has been in this cycle, okay, of a mental disorder. And you need to tell her primarily that she'll be seen by psychosexual counselors. And while you advise that, sertraline may be the cause why you are having sexual dysfunction, it is not as easy as saying that. All right. When you say such a thing, she might take that message home and she'll be like, okay, sertraline is causing me this. I'm going to stop taking sertraline. Got it, na? So that is counterproductive to your patient safety. What should you have said? What do you think, Dr. Taskin?
Uh, We can review the medicines or with your specialist doctor.
Exactly. Do not stop unless
Mm-hmm.
advised. Do not stop them unless advised. So you say that sometimes yes, the all the SSRIs they can cause hyperprolactinemia. They can cause which in turn causes your reduced sexual drive. So because of that. You need to basically tell her that it will be reviewed, but when you will be looked after by a specialist team of doctors, which will include psychosexual counselors, specialist nurse, or subfertility experts also, because that is another issue that she's having. She also wants to conceive, right? So she's come asking you at an ST5 level, not at an expert level where you need to do in-depth counseling for her, but you are going to advise her that she is going to need these things. Okay, and we'll review the doses of the medications. The strategies which can be tried there may include, okay, pay attention to the languages, may include reducing dosages or sometimes switching medications to other drugs, okay, or scheduling sexual activities or having drug holidays, but only after a psychiatric consult, okay, mental health specialist consult. Do not stop them before the doctor advises you. Okay, it's also advisable to involve the partner. That is again another very extremely important point here is that spending quality time with the sexual partner, involving them in the counseling sessions, having good communication with the partners, sometimes focusing on sensation versus anxiety. There is something called a sensate focus techniques. Are you aware of that? What it is, Dr. Taski? Hello?
Yeah, yeah,
Anybody?
hello.
Sensate focus techniques?
Um,
Hello. The rest
maybe a
are
part
also
of
welcome to answer.
foreplay, like which can relieve
Oh,
of
yeah,
stress,
yeah, yeah, yeah,
anxiety.
yeah, precisely. It's a method whereby there is physical contact, which is encouraged, which may be non-sexual, and then slowly, which is but pleasurable and turns into slowly sexual form of contact, and that can be encouraged. They can get more foreplay with the partners, try different sexual positions. Sometimes other aids as well in the terms of you will say aid when you are talking in a professional manner. Basically we are just talking about she can go ahead use sexual toys, etc., which will increase your satisfaction. This is what you need to tell her. You have to develop the ability to say these things out loud without hesitation. Okay, because these are very sensitive issues. If the examiners, especially for these tasks, lay examiner was there, and if they sense that you are hesitant to talk about certain issues, okay, that may be marked against you in communication. All right, so you have to have this method of yourself being able to and being confident enough to say these things without hesitation. Okay. So that is one thing. Now let us move to, so these are all the sex therapy related issues that you can help her out with. Additionally, now you move on to pharmacotherapy. Any idea if anything can be used? Um, yeah, Dr. Sri Divya. Hello. Come on, guys.
Since she's taking
Hello.
sertraline, you said, ma'am, she can be
Yeah,
having increase in the prolactin levels. So we can give her a
correct.
medication, either bromocriptine or cabergoline. I'm not sure.
Um, yes. Yeah, precisely. Actually, cabergoline or bupropion could be tried whenever there is hyperprolactinemia associated reduced sexual drive. So this could be given to her. However, remember that you are SD5. Okay, so you are bound by certain things. You cannot write a prescript for her at this stage. However, this is an exam and you are expected to know things. And to showcase those things to the examiner, so you will say that there are certain drugs, like, and even if you don't know, for example, then also you could, say that I'm unsure at this time whether some medications might help you. We'll have to take a consult, okay, by with my consultant or something, and then proceed with that. That would also be fine. But yes, if you can mention there is drug therapy like cabergoline, bupropion, but I would have to ask, review those with my consultant or your mental health specialist. Okay, and only then we can go ahead and prescribe this. You must also be made aware of any side effects of whenever you're prescribing anything. So you'll say that dizziness, headache, constipation, nausea, dry mouth, palpitations, hypertension, high blood pressure. These are possible effects that you can have with it. Okay. My question to you was next, which again had marks for applied clinical. Does laser rejuvenation, will it help me? Okay. That was not there in the exams, but it was just additional tweak here for you. Laser rejuvenation, sorry, can uplift a person's body image and self-esteem, and in that way it can help some women, but there's no physical benefit of the same as such. But if, however, she wants to go ahead with it, it's up to her. Okay, so that's the answer to that question. Right. Now, additionally, what else is remaining in your applied clinical thing?
Ma'am, actually, since it has not been now 2 years for them as an infertility, so do we need to order her test for these
The
tubal?
tests are already done. Her tests, basic tests are already done. The tubal
Yeah,
test,
basal.
there was the risk factor, which was chlamydia, okay, which
Okay.
was not elicited in history, but yes, because of the same, you would advise her to have tubal,
Uh-huh.
this thing, nonetheless. However, she's come asking you about it, and eventually she repeats the question. It's like, how about the pregnancy thing? That means you have to address it. See, how do you know what is being marked? Is depending on what the role player is asking. So she's still asking, what about my pregnancy? So you would say that if the tubal test can be offered to you because you had a risk factor which could cause blockage, one thing.
Mhm.
Um, Usually, even if this is open, the treatment would start at after the couple has finished 2 years, 2 years of regular and unprotected sexual
Unprotected.
intercourse. In her uh,
It's looking.
history, the issue is that intercourse is not occurring at all.
Yeah,
Okay.
yeah.
However,
Yeah.
however, remember this is again exam. So what we are
Mhm.
marking is your ability to tell her. So if you remember, NICE guideline for subfertility says that in case there is such debilitating sexual dysfunction, okay,
Mhm.
that the patient is not able to have satisfactory frequency of intercourse, then what do you do? That is what is being asked. Not, what will happen down the line. No. If we are, for example, in the past that vaginismus station used to come, you remember? And the
Mhm.
answer was like she used to say, if you cannot overcome this, then what do you do? So, tubal testing, if tubes are patent, then IUI6 cycles
IUI
will be
can.
offered to her. Okay, okay, after having tested for everything, all the infections and all. And if this does not succeed, however, and then test tube baby also can be offered, but this will not be funded by the NHS. Okay, because
Okay.
her husband was already
BM.
from previous marriage
Okay.
having a child.
One.
Okay,
And BMI is also 35 is
BMI is also 35. Yeah. So two factors going against. So, but you are advising her right now, weight reduction you have done. So these are the things that you need to tell her. Additionally, we'll offer you support group. So don't waste so much of your time and energy saying about the alcohol, for example, like alcohol maybe this is responsible for. If you would, I would like you to consider the same. Then I can give you this. Do it in one line. Can't you do it in one line? how do you save time in the stations? You just go ahead, tell her the management, like saying that, see, the alcohol is also known to be responsible for affecting sexual libido. Okay, and therefore I would advise you to stop this and can help you with alcohol, like Anonymous, which is a support group. Finish. Okay, all points in one sentence itself. It has to be very compact. 10 minutes is sufficient time, but just sufficient for most of the stations to do satisfactorily, right? So this is why you have to practice cutting things short, okay, saying them in a very consolidated manner. Otherwise, you'll run out of time as you did. Okay, and lastly, information. Okay, I'll give you written information about what we have discussed and document everything. Done?
Yeah.
Okay, so how do you think now you scored? Hello,
Yeah, ma'am.
how do you think you would score now in the task?
Mm,
It's okay. You can message me privately. All right.
okay.
So, sorry, I didn't catch that.
Yeah, ma'am. Okay.
Yeah. All right. So yes, this was the task we were supposed to do for today. Is there anything else that anyone wants to ask about this task? No? Okay. Um, all right. Is everyone happy with the task discussion? That means I can close it.
Yeah, ma'am. It was quite informative and descriptive. Thank you, ma'am, so
Mm-hmm.
much.
Thank you. All right. If any questions are there, you can put it up on the WhatsApp group itself. Okay. All right. So we'll be having more of these discussions. I will announce a few days before, and they are quite casual discussions. So it's not like a official announcement will be there many days prior or anything. So please be on the group, and you can tell your other friends who are interested in um, discussing the main questions as well. I know that there are people who have already answered and people who are sitting for the November exam also in this group. So it's just done as a measure to help everybody out. Okay. All right.
Ma'am, is
Thank
it
you
okay
for
if you... Hello?
yes. Who's this?
Ma'am, I just wanted to know, is it okay if
Okay.
we do this discussion alternate day? Only for half an hour at least?
See, the thing is that actually I would really love to, but then the thing is that I just delivered in March, so I have
Oh,
my baby who's not even 3 months yet, so I'm a little bit short on time, right? So
no problem,
still
ma'am.
I
No
will try
problem.
to make, and that's the main reason why we didn't have it pre May also, because pregnancy was a bit hard on me. But now since that is
No
over,
problem, ma'am. Thank you so much.
yeah, yeah, okay,
Dr. Uma, in this case,
yes.
as there was a sexual dysfunction part, if
Hmm.
they, in case there is a labial hypertrophy or something like that, how could we explain that part also to her in just a concise manner? Would we offer her surgery or something, or just psychologically, if
What
she's
what
thinking
do
that
you
it is?
mean by labial hypertrophy exactly?
That's what she feels, and the feeling for her that that the body image, as they say, sometimes there
Body
is
image
in some
issues.
cases.
Hmm. Okay,
Uh,
okay, okay.
so how
Yes,
can we?
you need to explain that cosmetic surgeries which are done are
Mhm.
majorly done for improving body image issues, and in that way, because she's a major, she can go
Mhm.
ahead with it, but there is no evidence that it will it definitely help her sexual dysfunction or help her in terms of what is the main complaint which is there, but it
Okay,
cannot be denied to her if she's insisting on it. For example,
okay, ma'am.
it has to be very
Okay, ma'am.
clearly mentioned to her. It is not been shown by any studies that it will help with
Mhm.
sexual dysfunction or increase her libido in any manner. Okay.
Okay,
However,
ma'am.
If
Yes, ma'am.
she feels that way and it is causing her distress, then she can go ahead.
Okay, ma'am. Thank you.
Got it, no? Yeah. Alrighty. Okay, thank you guys for joining in so much.
Thank you, ma'am.